Hey everyone, and channel into a topic that history book, but we were talking about the silent killer. For centuries, disease was a million. So what exactly is tuberculosis? It's an infectious, primarily attacks body like the kidneys, brain, active TB in there, droplets containing if another person, droplets they can. Now, here's where things get a bit complex. Not everyone who gets infected with TB bacteria becomes sick right away. This is a crucial distinction. There are two main states, latent TB infection and active TB disease. With latent TB, the bacteria are in your body, but your immune system keeps them under control. You don't have any symptoms, and you can't spread the disease to others. It's like the bacteria are asleep. However, for about 5 to 10% of people with latent TB, the bacteria can wake up and become active TB disease, especially if their immune system gets weaker. This could happen due to other illnesses, malnutrition, or aging. When TB becomes active, that's when the real problems start. The classic symptoms are a persistent cough that lasts for 3 weeks or more, sometimes with blood, chest pain, weakness, fatigue, weight loss, fever, and night sweats. Because these symptoms can be subtle at first and overlap with many other less serious conditions, people often delayed seeking help. This delay allowed the disease to progress and also increased the chances of spreading it to family and community members. This is why it earned its nickname, the silent killer. It could slowly consume a person from the inside out, often before anyone realized the true severity of the illness. Before the mid-20th century, a diagnosis of TB was a devastating blow. There were no antibiotics to fight the bacteria. Treatments were limited and often ineffective. People were sent to hospitals, often fresh air. The idea was that rest, good nutrition, and clean air could help the body fight off the disease. While this helped, some patients did not survive. The disease was so literature, and think of all the classic novels. Who was TB? The real, in the 1940s with streptomycin. For the first time, we had a weapon that could directly kill the TB bacteria. Over the following decades, more effective drugs were developed, and a combination therapy became the standard. This multi-drug regimen is highly effective, but it's a long and demanding process. Treatment for drug-susceptible TB typically takes about 6 months of taking several different antibiotics every day. It's vital too. Even if you stopping early can bacteria becoming drugs, much more dangerous. A form of TB. Preventable and curable. Tools like skin to detect it, and yet it remains in low and challenges like healthcare and the rise of strains mean the over public health around the world tirelessly to end their strategies, treatment, and it is a reminder. Become complacent. Understanding that effective treatment, world free of TB. Thanks so much for watching. I hope this gave understanding of still present. If you found this, please give it a subscribe for more. Stay safe and stay curious. See you in the next one.